Now comes the big question of that whether it's a job of hospital to manage data.
So see, one thing is there, till the time doctors do not fill up the required data sets, we will never be able to get the data. Whether a doctor does it, his admin does it, anybody else who is supervising and filling in data, a receptionist or a front desk person does it, we definitely need data sets. Without data sets, predictive analytics is handicapped, and there will be outliers. The second thing is that whether a hospital need to invest today or probably has to seek a leadership opinion or a management decision in terms of sharing the data, I don't think it is required. As far as, so every hospital today, which is a tertiary care hospital, has an HMIS vendor, has also got an EMR vendor to a certain extent. If those people are providing the same software in say 100 hospitals, and they create a central repository of patient data, which is non-anonymized, anonymized, which is mapped to a particular unique ID and not exactly patient information. A predictive analytic tool can work there to stratify the patient and map it to an MRN number, and the information then can go to a respective hospital for them to take any necessary action they want to take. They want to start a preventive program there, they want to reach out to that patient to do clinical marketing, upsell, cross-sell. I mean, sky is the limit, you can do a lot of stuff. But the question was that, is the hospital ready to manage that data or capture those data sets? I think if you see the history, we have been following FDA exactly what US is following today to a large extent. Even a lot of regulations that occur or happened in the rest of the world, we are closely following that. There will be a time where digitization in Indian healthcare industry will also become mandatory. So at that point in time, we have to be ready in terms of adopting all the digital concepts, so that otherwise the care quality will remain that abysmal as it is today.
Just to add to that, particularly in patients like cancer patients, now they come over years, maybe over a decade or 15 years, if lucky, maybe 20 years. We keep them on maintenance. So it is nobody else's job. It is really our job to manage the data and see that how the patient is progressing.
We many times talk about the US model, which is not one of the best examples of healthcare system to be given in the world. I believe, to take a divergent view, it is one of the worst examples of the healthcare system in the world, and it is reeking under its own pressure. Having one of the highest spending in the world, they have possibly one of the worst outcomes also. And the healthcare system there has become like a victim between the greed of, say, insurance companies and the pharmaceutical companies. And the patient and the providers are sort of revolving between the interest of these two. So I don't think that what is happening in the US is necessarily how it is going to happen into India. Probably we'll have to design our own mechanism, our own system, so that we don't fall prey to the same problems which the US healthcare system is facing as of now, where a chunk of the things are happening, and for every incremental unit of benefit what you are getting, you are spending 10x of cost. And now the big question which is facing them also is that, is the cost worth it? No doubt there are benefits out of it, but is the cost really worth it? Do we really need to put in that money? And I think Obamacare is trying to overhaul that only.
No, I think we are very good at that. For a moonshot, we have a Mars shot. So definitely, we will have our own way to go there.
Just to answer this, that whether it is hospital responsibility. Definitely it is hospital responsibility, but we need to remember that to get the best outcome or prediction or analysis, you need to have the patient's entire medical records or details wherever they are undergoing treatment. Suppose in my own hospital, when they come and I store and they go to the other labs and other facilities and and that is not available, then my record is going to be useless.
Exactly.
So you need to have the system in place. Now, I'm sure that if this gives the benefit, what you're asking, that is it worthy to go for this and who will pay for it? I have not done any analysis for my patients or my hospital, but I strongly believe if the outcomes are going to be like this, that you can prevent some of the emergency admissions, you can stop or prevent some of the patients, disease episodes, then definitely it is worthy to go for it. And I'm sure when the consumer, the patients, when they are coming and they are understanding the value, what they are going to get out of it, they will mind to share some expenses what ultimately is going to be spent for this. So if you can share, show, and discuss the benefit what they are going to get ultimately out of it, then it is worthy, and I'm sure the hospital should take lead in this.
I do also totally agree with this statement, like that's a hospital responsibility. Doctors are the first source of the information where they have to feed in. If you are writing something on a piece of paper, how do we digitize that? Right? So here question comes like, if your source of the information is not right, you cannot produce result ever right. That is for sure. Whatever tool, whatever technology you implement, you will be blame each other, right? So that's the first thing is, and as, yeah, please.
Absolutely. So there are 4 V's you must have heard. These problems with data, right?
Right. That's
Volume, the huge volume of
huge
data.
volume. Because whenever I was going to doctor and asking why you have done this,
Correct. Variety. In
and,
how
and
many
tomorrow
ways?
you are the person who is going to come to me and ask, can I have a Excel report of this guy? Can I have the details of this guy? I cannot give it to you, sorry.
So therein the question was that you are a node where data is created. Now, fine, whether it's your job to sort of manage that data also. So if you are a creator of that data, why not allow a third party to come in and do that job more efficiently, and the hospital is focusing on its core job of providing clinical services rather than ending up becoming an IT company also. Because the way, like you said, the 4V, the enormity of the data itself is going to turn a hospital into IT company sooner than later. And you will see that chunk of the management bandwidth is going in terms of upgrading the servers every time, and enhancing the skill set of people, which I don't think is really a core job of a hospital.
No, it's a game of, the club where you belongs to. 100 crore, 500 crore, 1500 crore. Then the way you grow, you will start thinking to change the technology model as well. I'm telling you very practically. If you are starting growing a 100 crore club hospital, I'm telling you my practical experience, these kind of technology, you will not think about it. You will skip always because they require huge investment, right? If I outsource something, definitely I will outsource with the premium amount. That's why I'm keeping my headache out. It's not lower kind of job. If I'm doing my in-house management, I can run that show in 2 crore rupees instead of paying 5 crore rupees to the outsource company. I'm telling you a very practical example. I've been experienced in the healthcare industry. So this kind of model, you can define the way you grow. The level 1, level 2, level 3, and you can basically easily go for it.
But can't we, Dr. Ruchi, shouldn't we look it in that manner? Let's forget healthcare for the time being. Let's purely talk it from a commercial perspective. At the end of the day, any business tends to outsource its non-core functions. And that is the whole logic of this outsourcing industry. And some businesses try to keep it captive, but that phenomenon also has gone where GE had to ultimately offload Genpact. And though GE is such a big company where it could have easily managed Genpact within its own fold, but then Genpact itself grew in such a big business that it made more strategic sense to divest and allow it to grow as a company. So my question was more from a futuristic perspective, that if hospitals are going to embrace data management and other solutions, should they just be content with the outcome part of it, or should they try to manage the entire ecosystem?
I think that has to be outsourced, because at one point in time it will, so as you said about the club, when the club will go to another club and you will enhance that, at that point in time you will then think of outsourcing again, because that humongous amount of data you will not be able to handle. So that is point number 1. Point number 2 is your data management company or your provider who is putting that healthcare system or whatever system in your company should come with a predictive analytics capability built in, so that you don't have to manage 10 vendors now. And that is why I say that in India, when we talk about big data analytics, we talk about predictive analytics, or even something as advanced business intelligence analytics, we generally partner through EMR and HMIS companies, because they are to be partnered with and they are already in touch with 100 hospitals. So this comes as an add-on directly. You want to use it, you use it. You don't want to use it, it's still a part of the system. So that solves the majority of a problem, because see, if I am a CIO of a hospital, and I think that there is a great value in predictive analytics, and maybe I recruit a person and pay him 50,000 bucks per month to look at that data and give me some insights as to where my operational efficiency is, or where my revenue is leaking, or even in the clinical part of the system. A human cannot do all of those algorithms and probabilities. B, if even if you retain him for 1 or 2 or 3 years and then he leaves, then another training cost is again humongous. How about if a company can do it for you, either through your HMIS vendor or directly to you in $500 per month? Now that is a thing that even 100 crore club kind of a hospital can definitely afford. But I think the fact of the matter today is they need to see value. So the idea is pilot, test, 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 and when the value is established, start paying for it.
I just want to add that it is a function of your economies of scale. As he mentioned, 100 crores or 200 crores. I remember in 90s, in a typical hospital of 200, 300 bedded setup, there used to be a kitchen either on the terrace or in the basement, okay, which is not in a very lucrative place. And there people only used to cook, they used to serve, housekeeping was also there, security person was also there. Now we don't even think that to keep those function as a part of your core activities. So that is the way we need to think in terms of your analytics and management of all these issues. So if you can't afford to have so many, costly, I should not say commodities, but professionals who are going to handle this function in your role, unless and until you have a huge scale of operations which can take care of that scale of economies.
I would say this is a journey. You see, 7, 8 years back, the server rooms used to be in the lower basement where all the webs of Makdi ka jala was there, and it was lying there. All that machine used to do is print the bills, and somebody is typing the report and that report is coming out. Probably age-old server is there. Junior manager types of executive was handling IT. Now we have come to a level that a reasonably sized hospital is having a CIO and well-equipped IT team. We have data centers now. So right now the focus is on controlling everything, probably from availability point of view, confidentiality point of view, data integrity point of view. But slowly and slowly, as PAX is coming, now terabytes and terabytes of data is being demanded. And for a hospital, keeping that infrastructure is not viable. So first, this will go to cloud. Cloud will be leveraged. Thereafter, probably compute will be outsourced. So it will be outsourced in such a manner that the hospital is just saving electricity and cooling. That's all. Everything they still manage. Thereafter, it will go to infrastructure as a service, platform as a service, and finally at the end will be application as a service. But we are at least a decade away from there.
I totally agree with you because it has to be in a phased manner. And for example, I'm giving you a classic example. The question is, who will outsource? How do we decide it? What is the logic to take this decision? Okay, this kind of hospital, number of year of experience, running experience, they have to outsource this. So in my opinion, let's say a hospital started 3 years back. Is that the right decision for him? Or hospital started 10 years back, it's a right decision for him. So in my opinion, like if we start from the day one, then it's very good. Outsource it. And if you already running 10 year of hospital, data will be very, very huge. And I'm sure like kind of you will become an IT company by that time, 10 years, right? Storage, servers, the kind of bandwidth you are having it, the kind of a user base you are going to have it. So that would be very, very difficult. So in my opinion, like partially agree, but it has to be in a phased manner.
So I think we can conclude by saying that big data and analytics, both from a provider and technology perspective, we agree that it is going to play a big role. How fast or how late we are going to adopt, that is a question mark. And probably our dynamics being very different from that of the Western world, say either be Germany or US, where it is more of a managed health, what we are getting. Here it is out of pocket health. And that scenario is also not going to change drastically in the next 5-10 years. So I think we'll take our own time in terms of setting this up. But what we can say conclusively is that the moment we cross that threshold, the growth is going to be exponential.